Okay, so what I have here is it is March 10, 2022 at 0550, and Jake Nursing's being treated for an elevated INR due to an accidental overdose of warfarin for atrial fibrillation. So what I have is I have my MAR and I have my parenteral drug monograph. Even though I don't have a physician's order sheet, I can still go ahead and give this medication, vitamin K, since it is double transcribed. So I have my patient here, Jake Nursing, FIN number 312-654-987, date of birth, January 1st, 1960, Dr. Skills Lab. My patient does not have any allergies. I'll be giving vitamin K on March 10, 2022 at 0600. Right now time is 0550, so it's okay to give vitamin K. So I will be getting my medication. So I have here vitamin K, given 10 milligrams. It is 10 milligrams per 1 ml. I'll be giving 1 ml of vitamin K, given intramuscular, and this is intramuscular, and given every 8 hours on March 10, 2022 at 0600. Right now time 0550, so it is okay to give vitamin K. Patient has no allergies, medication is not expired. So what I know about vitamin K is that it is a reversal agent for warfarin. What warfarin does is it increases your PT time and increases your INR number, which means you will be bleeding for longer and taking longer for you to clot. So vitamin K will reverse that. What vitamin K does is it will decrease your PT time and decrease your INR number so that you will be clotting quicker. The side effects I know about vitamin K that I will need to monitor for 30 minutes after giving it are shortness of breath, rapid and weak pulse, dizziness, pain and discomfort at the injection site, and low blood pressure. So I'll monitor for those. I'm going to look at my parenteral drug monograph. For vitamin K, the maximum single dose is I'll be giving 50 milligrams, but I'm only giving 10 milligrams, so it's within the safe dose window. In the intramuscular route, I'll be giving it undiluted. And then the potential hazards of giving vitamin K are hypersensitivity and anaphylactic reactions. But I see that Jake Nursing has no allergies, so this does not apply. So, but I will be monitoring for chest pain, bronchospasm, dizziness, hypotension, and any erythema, redness, pain, swelling, and tenderness at the injection site. That I will monitor for. So I'm going to gather the supplies I need. So what we have here already, we have our multi-dose vial of vitamin K to be given intramuscular. I'm also going to gather my, please assume these are all brand new, my alcohol swab. I'm also going to need my 18 gauge blunt fill needle. I'm also going to need my 22 gauge by 1 1/2 inch injection needle suitable for intramuscular, and I'm going to get my 3 ml syringe because we're giving this in because we're giving 1 ml of this. So what I'm going to do is I'm going to wash my hands, and now I'm going to clean in a circular motion for 30 seconds the top of my multi-dose vial. 30 seconds has passed. I let the vial rubber top fully dry, and now I'm going to get my 3 ml syringe. And I'm going to attach it to my 18 gauge blunt fill needle. And now I'm going to inject in 1 ml of air. I have 1 ml, and I'm now going to pull it down, and I'm going to discard of my blunt fill into the sharps. And now I'm going to put on a 22 gauge by 1 1/2 inch injection needle. Okay, I now have 1 ml of my vitamin K inside of this syringe. So now I'm going to make a label for it. So the patient is Jake, nursing, and I'll be giving vitamin K intramuscular, and I'll be giving 10 milligrams of it, which equals to 1 ml. That is because it is 10 milligrams per 1 ml, and I'll be giving it on March 10, 2022 at 0550, given by me, HYL, University of Manitoba, student nurse, 2nd year. So I will show you my label. Here is my label. And now I'm going to do my second check. So, right patient, Jake nursing, Jake nursing. Right medication, vitamin K intramuscular, vitamin K intramuscular, vitamin K intramuscular, and vitamin K intramuscular. Right dose, 10 milligrams. 10 milligrams, it is to be given, it is 10 milligrams per 1 ml, and I have 1 ml. Right route is to give it intramuscular, intramuscular, and this is intramuscular, and this is intramuscular. Right time to give it every 8 hours on March 10, 2022 at 0600. Right now time is 0550, so it's okay to give vitamin K. That is my second check. I'm now going to put my multi-dose vial away. I'm going to get my label and my syringe, and I'm also going to get my pen, my pencil, and eraser, simply because this is a video demo, and I will not be, and in a real hospital, I'll be documenting the MAR with a pen. And I'm also going to get my alcohol swab, and I'm also going to get my cotton ball, and I'm going to get my gloves. Now I'm going to go head over to the patient's bedside. Upon entering the patient's bedside, the first thing I do is I do an entrance safety check. My entrance safety check makes sure the patient is alert, awake, not in any pain and distress, the floor is free of any fall hazards, and the call bell is within reach. So I'm going to enter the patient's room. Hello sir, my name is HongYang Lin, and I'm going to be I'm a University of Manitoba student nurse, and I'm just going to be giving you an intramuscular injection. I'm just going to wash my hands. Is it okay if I quickly take a look at your wristband? So I have here Jake nursing, FIN number 312-312-654-654, 987-987. Date of birth, January 1st, 1960. Dr. Skills Lab. Great. Sir, can you tell me your first name and last name? Can you tell me your date of birth? And do you have any allergies? No. Now I'm going to elevate his bed up to the higher position. I'm going to wash my hands and do my third check. So I have here right patient, Jake nursing. Right medication, vitamin K intramuscular, and vitamin K intramuscular. Right dose, 10 milligrams. It's 10 milligrams per 1 ml. I have 1 ml. Right route is to give it intramuscular, and intramuscular. Right time to give it every 8 hours on March 10, 2022 at 0600. Right now time is 0550, so it is okay to give vitamin K. So Mr. Jake nursing, what I'll be doing is I'll be giving you vitamin K. The reason being was you were given too much warfarin, and too much warfarin increased your PT time, and increase your INR number, which means it will take a really long time that you keep on bleeding and takes too long for you to clot. So vitamin K will reverse that. Vitamin K would decrease your PT time and decrease your INR number so that you will clot quicker. Some side effects of vitamin K I'll be monitoring for 30 minutes after giving you the injection though are some pain and discomfort at the injection site, shortness of breath, dizziness, rapid and weak pulse, and low blood pressure. But as of now, I've checked your full set of vital signs, checked your paying close attention to your pulse and your blood pressure, and I checked your PT time and INR number, which were both very high, which indicates the use for vitamin K. Do you wish to take your vitamin K? Yes, he does. So I'm gonna wash my hands. So the site I'm gonna be using is I'm gonna be using your left ventral gluteal site. So I'm gonna roll the patient over into his right lateral recumbent position so I can use the left ventral gluteal site. So I've washed my hands. So when I landmark the site, I'm gonna remove his pants to expose the site, and I'm gonna place my palm onto the greater trochanter. I'm gonna place my thumb pointing towards his groin, my index finger towards the anterior superior iliac spine, and my middle finger towards the iliac crest. And the left ventral gluteal site is between my index and middle finger, so I'm gonna place cotton ball here to reference it. I'm now gonna wash my hands, and I'm gonna use this as my injection site. So I'm gonna put on my gloves. So now what I'm going to do is I'm going to clean the injection site for 30 seconds using an alcohol swab in a circular motion, and I allow the site to fully dry. And now I see the site here, so I'm going to be using a method called the Z-track technique. And then I will have to stabilize using the ulnar aspect of my hand, and then I'll be injecting at a 90-degree angle. And I'm going to stabilize. So I will aspirate, and I see that there is no blood, so I'm going to slowly inject the medication. And now I'm going to remove the needle, and now I can let go of my Z-track. So now I would verbalize. What I would do is I would verbalize that I activated the safety mechanism, but I want to reuse this needle for video demo, so I just say that I activated it, but I'm just going to recap it and put it in the sharps. I'm going to now place a cotton ball onto the site and hold it there for 30 seconds to a minute. And that time has passed. I now remove my gloves. I wash my hands, and now I will document that the medication was given on 0550 by me, HYL, University of Manitoba, student nurse, second year. And now I'm going to show it to the camera. Can I have that? 0550 by me, HYL, University of Manitoba, student nurse, second year. Thank you, Mr. Jake Nursing. So I will be coming back in 30 minutes to monitor your full set of vital signs and paying close attention to your pulse and your blood pressure, and I'll be seeing if your PT time and your INR number have both decreased, which indicates that vitamin K is working. And in that 30 minutes when I come back, I'll also monitor for the side effects, which could be shortness of breath, rapid and weak pulse, dizziness, low blood pressure, and pain and discomfort at the injection site. As of now, I'm going to do an exit safety check, which means I'll put his call bell within reach. I'm going to lower his bed back down to the lowest position, make sure the patient is comfortable and not in any distress, and that the floor is free of any fall hazards. So that's my exit safety check. As I gather all my supplies and leave the room, here's the documentation that I'll do. So I've reviewed the physician's order of the patient having an elevated INR due to an overdose of warfarin. And what I did to intervene was I gave the double transcribed order of 10 milligrams of vitamin K, and I gave it at the left ventral gluteal site. And I explained the procedure to the patient, and he tolerated it well. So my plan for now, because I've left the patient in a comfortable position with no distress, my plan for now is just to monitor his vital signs, paying close attention to his pulse and blood pressure, and I'll also monitor to see if his PT time and INR number have both decreased, and I'll also be monitoring for the 5 side effects that I have previously stated.